So there are three ways that can help. There's probably 10 or 15% of patients who develop cancer where they may have inherited a gene, a change, which actually increased the chances of them getting that cancer. The best known is in breast cancer, where, for example, the actress Angelina Jolie had both breasts removed because her mum had ovarian cancer. That was an inherited gene. And most people with cancer don't have that, but some people do, and they just don't know it because they've never had genomic testing to work this out. Sometimes patients are told, oh, but we've tested you for the top 2 or 3 genes, but there's often 10 other genes you haven't been tested for. And with genomic testing, we can make sure that we look for all the possible inherited genes. But remember, probably 85% of patients, that won't be affecting them, and they can then reassure their families that this isn't what's involved. The second thing is to actually work out what the moving parts are within your cancer that is making it grow. Now, each cancer is different in that regard, and you can get cancers that under a microscope may look similar to a pathologist, and yet when we look at the genes, they're very different, and the best treatments for those cancers might be quite different. Let me give you an example. One may respond to immune therapy, and the other one may not respond just because of those genetic changes. So that would give you a roadmap going forward, not only conventional treatment, chemotherapy and radiation, but more importantly with new immune therapies, genetic cell therapies that are coming into practice around the world. The third thing is often the monitoring of your cancer. Sometimes the most difficult thing for a cancer patient is they're told, well, we'll have to give you this course of treatment and we can't decide until it's finished whether or not it's worked or not. And that's very frustrating, and it's also demotivating if you're a patient or a family. Whereas often now, by following the genetic changes in a blood test, so these are the genetic changes in your cancer, but we can pick them up in the blood, we can tell you within a few weeks whether a treatment is working or not. That way you don't waste your time on treatments that don't work, but on the other hand, if you're on a good treatment that's going to work, you get the first good signs of that at a time that motivates you to keep going.